I am currently working on a Bartonella textbook that I hope will be definitive. Right now it's 1,300 pages, and it's not ignorant fluff like when I published the first Bartonella books on the planet. Some people criticized them, and they deserve to be criticized, but there was nothing else. Nobody's jumping in to do a better job. Although Stephen Buhner, about 6 years later, did offer a book that had some use, and Steve is very nice. I would like to talk briefly about labs to use for Bartonella. Now, I have talked about using a pathologist, microbiologist, that's very good at staining and detecting Bartonella in the red blood cell, on the edge of the red blood cell, and in the fluid or plasma of your blood. Of course, it's in the wall, 60,000 miles of tubing in your human body. So one would be what I just mentioned. The thing is, those are very hard to find. Most microbiologists and pathologists that do look at smears miss it. And it takes quite a lot of training to be able to stain it right and see it. Well, we have some other options. One would be IGeneX has invented a genus Bartonella. So right now I have published that there are 23 species that infect humans, and in 1990 there were 2, and 1991 there were 3. And much to my shock, so-called Bartonella experts, who virtually everything they say is wrong. And one example is they're telling you just use any old commercial lab, and it's been documented they fail. And I won't go into all the literature on that, but they're aware. They're talking about 2 species and there's 23. What do you say to that? So let me go back to the labs. So IGeneX has invented a genus immunoblot, which is much higher technology than the big commercial labs that take your insurance and in return do a very cheap, outdated test. So if there is a 32nd species that we've yet to detect, the immunoblot genus will detect every single Bartonella that infects humans that we haven't even discovered yet. So that's an amazing test. Now be careful. If it says IND, it's not indeterminate. If you look to the right of that, it says you have 1 species. My preference is to say it's a weak positive, and when you have 2 more species, then it's a high positive. But, I don't own the lab, and who am I to correct Dr. Shaw, who's a phenom and a gift to the world? Then I've already mentioned T-Labs is very good, and they are about 66 to 70% detecting rate of Bartonella blood smears. So before it was here in Florida, I was on dream teams, usually with about 5 to 8 elite doctors, and some outside of Florida had access to T-Labs. And if they did 4, 1 would be negative, but it wouldn't be the last one. And that's okay. I don't need T-Labs to be like coming out of heaven with absolute perfection. 66 to 70% pickup rate is phenomenal. And then there is also an option with Galaxy Labs. Now, that's run by Edward Braceworth, who's the father of modern Bartonella, and there's nobody close. He has at least 200 peer-reviewed scientific journal articles on Bartonella, and if you get into reading all this literature, and the last 6 years has really taken off, you'll find his name in like half of them or more. And what he's been able to do is he invented a growth medium that isn't just blood, bright red at the bottom of a petri dish. It's very high tech, and the Bartonella grows on it very well. Then he takes it and he's able to send microdots 20,000 from your sample and look for DNA in 20,000 samples. And I believe they call that digital droplet PCR. Simply, his pickup rate is about 30% with one sample. So what we think is good is doing what they've shown in research is very effective. Do a sample Monday, Wednesday, and Friday, because Bartonella is not static. You may see the DNA on Wednesday, but not Monday and Friday. That's okay. So if you do 3 samples, you're at a huge chance of seeing DNA from Bartonella, and then they will give you more information with your positive. So those are places to start. I do use indirect testing, and in our top depression book coming out in November 25, we do list some other indirect tests that should be done for anybody with tick-borne infections or anybody with chronic illness that smart doctors are not able to fix. So in terms of labs, IGNX genus, both M and G, immunoblot. It only helps if you get their other species tests, and they do have some other tests. Then T labs to visualize it, and then you also have Galaxy, which will do 20,000 Dopplets on the blood after they grow it in the best patented growth media on the planet. And now, some people are tight with funds. Vibrant is a low-cost test that is much better than typical commercial labs, and some like DNA Connections for urine DNA testing. But you'll find that practitioners have very different opinions on those 2 labs. I found them to be helpful with people that are financially very tight. Okay, thank you for your time, and you are my prized marsupials. Have a great week. Bye-bye.
I wrote the first Bartonella textbook in 2008, but this new one will be authoritative for many years.